Hi, I'm Dr. Elizabeth Chiang and I'm an oculoplastic specialist. And this is my first video and I want to talk about why people get what's called chalazions. Some people call them styes and sometimes they're called hordeolums. So there are multiple components to the tear film. There's not just a water component, but there are salt water made from the lacrimal gland, but there's also oils and mucins made in other glands in the eyelid. So there's something called the meibomian glands, and you've got 50 of these in each upper eyelid and 30 of these in each lower eyelid, and they produce that oil part of your tear film. So just like you put lotion on your skin when it's really dry, you don't put water, you need that what's called emulsification factor, that thickening agent that's really going to lubricate, and that's what comes from the meibomian glands. Unfortunately, for some people, these glands can get stopped up, and when they get stopped up, the oil continues to be produced, but it gets backed up if it can't express out, and that's why you get a bump. That bump is just that backed up oil gland, and that also creates inflammation and sometimes can get infected, and that's what a hordeolum is when a stye gets infected. And that's because bacteria can actually use that oil as food and then grow inside that area. So if you Google on the internet what to do, how to treat, you hear or see that you should use warm compresses. And this is the one thing that people come to my clinic and they say they've been using the warm compresses, but it really hasn't worked. And I can tell you that there are better ways to do warm compresses. So most people, when they come to my clinic and I ask them how they're doing the warm compress, they're putting hot water on a washcloth and putting that over their eyes. Unfortunately, hot water on a washcloth doesn't stay warm for very long. After about 2 minutes, it's cold again, then you have to reheat that up. As you're reheating that up, your eyelid's cooling down. So really you want something that's going to stay warm for a good 10-15 minutes. Just like a frozen dinner, if you don't get it warm to the center, then it's really not going to be warm. And the reason to get it warm is just like if you heat up butter, it goes from solid to liquid. You want to heat up the oils inside that chalazion so it's more liquidy so that it can then express out. So what I recommend is to either get yourself one like an eye mask. So this is a Barcelona Thermopearl eye mask. They sell it at Walgreens for $12.95. Target has another eye mask for like $8. You can get a whole variety of different masks at Amazon. And so you put in the microwave for like 15 seconds up to 30 seconds. Please read the instructions on the mask. And then that way you have something that's going to stay warm for a long time. Then put that over your eyelids for a good 10-15 minutes. And then after you warm up the chalazion, then what you want to do is actually massage on the bump so that you're actually forcing that melted oil now out of its natural opening. Once you do that, your vision may be a little blurred because you've got all that extra oil. I do encourage people to do eyelid scrub, so you can put some baby shampoo in a washcloth at this point and actually just scrub right along your lashes. You can drape the washcloth and just scrub right along your eyelashes. The gland openings are right next to your eyelashes, and that's just to remove any excess oil. And if you do this when you newly have a new chalazion, then usually you can get it to go away without having to have any procedure to actually drain it out or any other kind of medication. So hopefully this helps you get rid of your chalazions or styes. Thank you.